news day continues here on One News Now. I'm Riza Diaz. The Health Department reports over 2,000 new COVID-19 infections. That brings the total caseload in the country to more than 523,000, nearly 37,000 of which are still active and contagious. The virus claimed the lives of 71 more patients in the past 24 hours, pushing the nationwide death toll to over 10,500. Now, some 475,000, meanwhile, have gotten better from the disease, with 146 new recoveries reported today. The Foreign Affairs Department, meanwhile, reports 33 new infections among Filipinos abroad. The case tally among OFWs has climbed to over 13,900, with more than 950 deaths and over 8,900 recoveries. The Department of Health isn't too keen on exploring anal swab tests, which is now being used in China. Health Undersecretary Maria Rosario Vergeres says this particular kind of test is being used to determine whether COVID-19 patients can already be discharged following recovery. Vergeres adds that while the government is open to studying such method, there are still some considerations as to how to conduct it.
Bukas naman po ang gobyerno sa mga ganyan. Kaya lang, kailangan din po natin i-consider it's going to be very inconvenient for the patient and also for the healthcare worker kung gagamitin po iyan.
Vergeres also downplayed the need to wear double face masks, saying current protocols still suffice in ensuring protection against COVID-19 infection.
Makikita ho natin ito pong paggamit natin ng face mask, which provides us about 60 to 70% protection, plus the face shield and the physical distance will provide us about 99% protection.
The Cebu City local government says it is challenged by the Octa Research Group's projection that the average new daily cases in the city could double in 2 weeks. Speaking to us this afternoon, Cebu City Vice Mayor Mike Rama maintains that the LGU has always been on top of the situation. This despite data showing a continuous spike in daily new cases in Cebu, particularly in Cebu City, since last month.
The hospitals and our facilities, we all are not much in a state of being overwhelmed, and we even have opened up again the barangay isolation centers.
Rama also notes that the LGU has already spent about 3 billion pesos for its pandemic response last year, an appropriation marred in controversy due to a reported lack in transparent liquidation.
We are practically have spent already, I think, even highest among LGUs with our population, already more than 3 billion. That is how we have been confronting this issue about COVID-19.
And we'll be back with more stories after the break. Keep it here on One News. You're watching One News Now. I'm Riza Diaz. Health officials are preparing for the country's participation in the World Health Organization's Solidarity Trials ahead of formal trial requests from the WHO. DOST Philippines Center for Health Research and Development Director Jaime Montoya said the UP Philippine General Hospital will be the lead implementing agency in the trials. Now, some 15,000 Filipinos aged 18 to 59 will also participate. At least 21 vaccine trial sites have been determined in various cities in Metro Manila. The government has already allocated 473 million pesos for the WHO trial, which was initially set to start this month. Preparations will continue pending the WHO's application for the vaccine trial.
This includes endorsement from the LGU for the mobilization of local leaders, face-to-face orientation and training of local leaders by the trial team, community setup for deployment of mobile teams, supplementation of manpower from nearby hospitals, and face-to-face orientation of potential participants pre-trial by the trial team.
The Environment Department is calling for the proper disposal of used face masks and shield to avoid contamination. In today's Laging Handa press briefing, Environment Undersecretary Benny Antiporda said the use of face shields, masks, and gloves is useless if these are not disposed properly. According to Antiporda, the number of discarded so-called household healthcare waste is alarming. As a result, they plan to allocate yellow trash bins to each barangay that will aid residents in properly disposing the items.
Immediately, we came up with the yellow bin kung saan ipamimigay po ito sa bawat barangay. Kahit paano, tig-isa po kada isang barangay ang bibigyan natin para masigurong meron lang sign kung saan po nila itatapon ito pong kanilang mga household healthcare waste. Hindi po ito hospital waste. Ito po ay household healthcare waste na ginagamit po natin sa araw-araw.
Now, as countries begin inoculating their population against COVID-19, the virus continues to mutate. New COVID-19 variants are being detected in more countries. What does this tell us about the pandemic? The details from Bloomberg Surveillance.
Yeah, I think that's going to be a continuing problem. It's completely understandable that so many people want to get the vaccine, and countries are thinking about their own populations and trying to prioritize those for vaccinations. But it's important to also understand this is a global pandemic. And what we've seen with some of the variants that are emerging is anywhere that the virus is replicating unchecked sets up a situation where the virus can mutate and change and evolve and perhaps get around more of these vaccine-induced immunities. So we have to keep an eye to the global pandemic and realize that it's to all of our benefits to knock down virus replication across all countries and not leave areas where the virus can smolder and mutate and change and perhaps render our vaccines less useful.
So, Andrew, what are the vaccines that are now useful? There's Novavax, the Prime Minister of the UK yesterday saying this was great results. Does it work against the South African variant?
Yeah, so the Novavax press release came out yesterday. It appears that the vaccine has very good efficacy, around 80+% in the UK. The study was also done in South Africa, where we have one of these variants circulating that appears to be a little less sensitive to the vaccine. So there the efficacy went down to about 50%. Now, that's still good. That still tells you that the vaccine is generating an immune response that recognizes this variant, and that South African variant is really the one that scientists are most concerned about. So I think it's good news, but it is a warning sign that says the virus is starting to change, and we need to increase our efforts at following the virus and tracking it and updating the vaccines when appropriate.
So, Andrew, could we be in a situation much like the flu where we need to get a new vaccine shot every year? And given what we know, the science behind it, would we be able to do that?
So it's a little too early to say whether this is going to look like influenza. I would tend to think that we're not going to be in that same situation as we are with influenza. This virus replicates or mutates at a much slower rate than viruses like influenza. It's also not clear how many more mutations this virus can handle. Influenza can handle a lot of mutations. The coronaviruses, it's not clear whether they can handle a lot of mutations. So it's early, and we can't predict that. I will say that most of the vaccines are generating stronger immune responses than our flu vaccines, so I'm hopeful that we won't be in a situation where we'll have to update the vaccine and initiate vaccination campaigns on an annual basis.
Now, for more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.